Thank you all for joining the MedGlobal's webinar on for frontline healthcare workers. We have on our panel today Dr. Nour Akhras, who's a pediatric hospitalist and pediatric infectious disease physician from Chicago. She has done global health medical work for the last 6 years in Turkey, Greece, and most recently in Yemen, and has also been a member of the committee in Syrian American Medical Society. Today, Dr. Akhras will be providing the field team in Bangladesh, our medical doctors, nurses, and medical assistants with a overview of the COVID-19 outbreak, as well as answering some of the questions they may have regarding the COVID-19 outbreak. So we can't see the screen. Over to you, Dr. Akhras.
Hello, everybody. Okay, so I'm just gonna do like a brief overview of the disease and where we are today. So we can just advance the slide, please, B. So this is, it's just, we're gonna give a brief background, clinical presentation of the infection, prevention, mitigation strategies, and the relevance of the infection. Next slide. Okay, so as I'm sure you're all aware, there was an increase in cases of pneumonia of unknown etiology in Wuhan, China at the end of last year, 2019. And so this is just a brief history of how we got to where we are today. So on the 3rd of January of this year, the novel RNA virus was identified out of the BAL specimens of a lot of these patients with an unknown etiology for their pneumonia. And so subsequently, that RNA virus was sequenced, and it was identified as SARS-CoV-2, and that's what it was named in 2019. The 7th of January 2019, the WHO named the virus SARS-CoV-2, and the disease that's associated with SARS-CoV-2 is COVID-19. And so in March 11th, the WHO named this infection and the spread of the infection as a pandemic. So as you may or may not be aware, pandemic means that the virus has spread to multiple areas throughout the earth, throughout the globe, so the majority of areas, and that it's hard to contain. Next slide. So I had put this presentation together for last week, so those were the numbers from last week. So we're actually over 1 million cases as of yesterday. I think we're at like 80,000 something deaths as of yesterday. And the territories that have reached, the virus has reached is over 214 territories and areas. Next slide. So the clinical presentation for most people is that they come to seek medical attention for fever, fatigue, and a dry cough. And then the less common symptoms are headache, diarrhea, and sore throat. So the good thing about this virus is that most people will recover nicely. So 8 out of 10 people will have a mild disease, can stay at home or stay where they are, and they don't need to seek actual medical attention, but 20% of people will. Next slide, please. So this is a respiratory virus, which means it's spread by respiratory droplets in contact, and airborne if we are performing airborne generating procedures, which are like intubation, CPR, nebulized treatments. All of those produce aerosol. And so once you aerosolize the virus in large quantities, it can become airborne, which means it can stay in the air for a couple of hours in the same room. So as with all respiratory viruses, the way to prevent them is to frequently wash our hands or sanitize, make sure our hands are clean, because as you all know, the way that respiratory viruses enter our bodies is when we use our hand that has maybe a virus on it from touching something, and then we touch our face. So the major portals of entry for the respiratory viruses are our eyes, our nose, and our mouth. So using good hand hygiene is probably the #1 way to prevent the spread of the virus. Other ways to prevent the spread of the virus is to maintain a distance between people, because when there's somebody who is contagious or infectious, when they speak, the droplets can come out of their mouth. And if you're within 2 meters of them and you're inhaling, you can get the infection from them, especially this pertains to people who are asymptomatic but contagious. So we'll talk about that in a minute. Also, other ways to prevent the virus from spreading, especially in areas where it's crowded, like in refugee camps and things like that, is to really educate the population about respiratory etiquette. Meaning, if you're sick and you're coughing, it's really important to cough into your elbow and not in your hand. I mean, if you can, if all you can do is put your hand, that's fine, but make sure to wash your hand after or sanitize. Or if you have a napkin or a Kleenex, you can, sneeze or cough into that and then throw it away and wash your hands. So it's really important that during the spread of this infection throughout the areas, that people who are sick practice respiratory etiquette. And another way to prevent yourself or other people from getting the virus is to, again, avoid touching your face. So I think human beings are probably very unaware of how often they touch their face, but we probably do it quite a bit. And so if you just try to practice that, being aware of how often you touch your face, you'll come to see that you probably do it a lot. And preventing yourself from doing that will help you prevent yourself from getting the infection. And other methods of preventing yourself from getting severe infection is to prevent yourself from doing things that harm your lungs. So smoking, for example, or vaping, hookah, and all of these things, these injure your lungs. So if your lungs are already injured, you're more likely to have severe or worsening infection when you do acquire the virus. And then finally, staying inside or staying away from other people when you're sick. So that's really important too, to prevent the spread of the virus. So if you're able to stay in a place far away from other people, that's really good. Sometimes space is limited and you can't do that. But just kind of like, if there's somebody sick in the family, trying to keep them in one area and then bringing food to them as opposed to them getting up to go get things. So just kind of trying to confine them as much as possible to one area until they recover from the infection. Next slide, please. So a lot of talk has been going around about the transmissibility and the case fatality rate and things like that. And this is a rapidly evolving situation. It's been rapidly evolving since the onset, since December. And so what I say today may be different tomorrow, and there's maybe more data, the next day and things like that. So it's just really important to keep up to date about what's happening. But the relevance of why this is such an important or dangerous situation is that the transmissibility factor for SARS-CoV-2, so that's the number of people who are infected by an infected person. So it's called R0. So in virology or infectious diseases, we have this entity called R0, and that tells you how transmissible a disease is. So the transmissibility factor for SARS-CoV-2 is 2 to 4. So that means, and some studies are now saying that might be even up to 5. So that means for one infected person, they infect 2 to 5 other people. And so just to give you some comparison, Ebola has a transmissibility factor of 1.9. The seasonal flu that comes every winter season has a transmissibility of 1.3. And measles is very infectious. It's got a transmissibility factor of about 12. Another thing to highlight about the SARS-CoV-2 virus is that it has a long incubation period. So the incubation period can be from 1 to 14 days, and the average is about 5 days. So that's the period where the virus is replicating in our bodies, in our nasopharynx mostly, and we're contagious, but we don't know because we don't have symptoms. So if you remember, for example, SARS, the first SARS and MERS, both of those had a shorter incubation period. So when you got infected, you got sick right away. You got symptoms right away. And so that helped kind of mitigate, because when people got sick, they didn't go out and they weren't out infecting other people. But with this disease, with this infection, you can have it and you can be incubating and infectious and transmitting and not even know it. And so that's part of the reason that it spread so quickly and it spread so fast, because people weren't staying at home and they continue to transmit not knowing. And we know that there's also asymptomatic transmitters. So people who get the infection and their body fights it off, and they never even knew they were sick, but they were infecting other people. Well, if we talk about the case fatality rate, it's about 2 to 3%. And again, in different localities, it's different depending on how much access there are to ICU beds, to ventilators, to hospitals, and things like that. So obviously, in places where there's not that much access, there may be a higher case fatality rate. But in general, 80% of people will recover just fine, as I mentioned, and 20% of people will require hospitalization. And the older you get, the higher your risk of death or mortality from this infection, and the higher your risk of needing a ventilator. And so the big take-home point here is this red line here, that 20% of infected people will require hospitalization. So again, people will say something like, oh, it's not a big deal, it's just a mild infection. And that's true for most of the population. But if you have a population that's infected and 20% of the population at one time requires hospitalization, there's no hospital system, whether in a developed country or underdeveloped country, there's no hospital system that can intake 20% of the population at one time. And that's why this is very dangerous, and that's why this is very important. Nobody on the earth has immunity to this disease. It's a new infection, so none of us are immune. So most likely, 70 to 80% of us will get the infection. But the way to not overwhelm a healthcare system is to prevent everyone getting it at once. And so mitigation strategies in places like the United States have been to stay at home. So we've told everyone in our cities and in our country who can stay at home to stay at home. So people who have never worked from home are now working from home. Kids are not in school. So this is the only way to slow down the spread. We're not going to be able to not have it spread. It is going to spread, but it's really important to slow down the spread so that we don't overwhelm the healthcare system of any city, country, town, or anything, because there's no healthcare system that can take in 20% of their population at one time. Next slide, please. Oh, that's it, I guess.
Thank you, Dr. Akhras. We have been receiving some questions from our participants, which I will be sharing with you for further guidance and explanation. So first question is, does this virus survive in dead bodies? And if so, for how long?
Yeah, that's a good question. So it probably does survive in dead bodies, at least for 24 to 48 hours. So it's really important that people who are either washing the bodies or preparing the bodies or burying the bodies wear protective equipment, meaning either gloves or mask and a gown if possible, to take care of the bodies. So yes, the virus probably does most likely lives on the body of the deceased for at least 24 to 48 hours.
The second question that we've received is, does the SARS-CoV spread through water, or does it have any spread through water sources?
So there's not really been evidence of that, but again, I don't know if that's actually been studied. So I don't think so. I haven't seen any of that. It's been mostly in respiratory secretions. It is transmitted fecal oral secretions also. So in like diapers of young children, in the feces, the virus can live there. I have not seen anything that said that it spreads through water sources.
The third question we have is, what happens when the virus enters the patient's stomach?
So there are reports that this can also cause diarrhea type illnesses. So a lot of children particularly will come in with a GI illness. And we know that from other coronaviruses. So this is not obviously the first coronavirus. There's many coronaviruses that spread throughout the winter seasons. And many of them also cause GI illness. So patients with SARS-CoV-2 can present with GI illness, meaning vomiting and diarrhea.
Okay, vomiting and diarrhea. For example, for screening purposes at facilities, is it important to also include vomiting and diarrhea as one of the screening criteria? Because overwhelmingly, we have seen that for screening, respiratory symptoms are what is emphasized in most protocols right now.
Yeah, so especially adults mostly will have the respiratory symptoms and fever, but children can present more with just diarrhea. So I would ask about that.
So for children, focusing a lot, putting more emphasis on diarrhea would be important. Okay, next question. What is there any significance to shedding the virus in the feces? I guess this is, again, keeping in line with the questions relating to spread through fecal oral fluid.
Yeah, so there was a study out of China recently that showed that children can shed in their feces up to 30 days. So it's really important to practice hand hygiene after changing diapers and things of that nature.
The next question we have is, if the virus presents over the surface is present over the surface of vegetables or fruits, how long will it survive, and how can we disinfect fruits and vegetables?
So fruits and vegetables, again, I'm not really sure if any studies have been done about fruits and vegetables specifically, but we do know that it survives on different surfaces for 3 to 4 hours or 1 to 2 days. And so with your fruits and vegetables, just washing them well for more than 20 seconds probably will help you eradicate it from your fruits and vegetables.
The next question is about personal protective equipment. Specifically for screening purposes, what kind of personal protective equipment is recommended for those who conduct screening at health facilities?
So if you're just, you mean screening like just asking questions?
Yes, asking questions and perhaps taking the temperature, pre-triage screening, for example.
Yeah, so if you're just asking questions and taking temperature, gloves and mask is fine.
Also for patients, what kind of masks should be given to patients who are suspected of being COVID-19 positive?
Yeah, so they should be given a surgical mask. So that's for source control. So if that's available, giving the patient a mask as well as yourself a mask when examining them is going to be your best way to prevent yourself from getting the infection.
Another question we have is on, so asymptomatic carriers. There's a lot of concern about asymptomatic carriers, especially at screening and triage points in Bangladesh. There is a lot of hesitation towards examining and addressing patients at screening points relating in fear of patients being asymptomatic carriers. So do you have any advice for people who will be engaging in that particular task at health facilities?
So again, it's really important to listen to your public health officials in your area because the spread is different in different areas. So, early on, for example, in my city in Chicago, early on, maybe like 2 or 3 months ago, we weren't talking about, or 2 months ago, we weren't even a month ago, we weren't talking about asymptomatic transmitters because we didn't have a big spread. But now we're definitely there. So now for our patients, I tell physicians that you need to just assume that everybody can be infected and treat them as in that way. So at some point in your area, your public health officials will say that there is community spread and and to treat all patients as if they have the infection, meaning treat all patients with a mask and gloves at the minimum.
Thank you so much. Another question we had was any specific recommendations for healthcare providers after they have seen or after they have handled suspected COVID-19 positive cases as self-protection, in addition to hand hygiene and wearing personal protective equipment, any personal measures that they can implement in their personal lives to stay healthy?
Yeah, so besides that, good hand hygiene and PPE, I think it's important when you get back to your place of residence, again, to wash your hands really well, be aware of washing your hands before you get into your house or your place of residence, and washing all of the clothes that you wore for that day, if that's possible. So that's something I do when I get home. Like I don't let my kids come by me. As soon as I get home, I get into the bathroom, I take a shower, and I wash all of the clothes that I wore for that day. I also try to sanitize anything that I've taken with me, that like my hospital badge or usually that's it. I try not to take anything inside the hospital with me except my hospital badge.
Okay. So any like bags or personal items you would recommend that we sanitize before entering the home?
Yeah. Unless you're going to leave it outside, your shoes or I leave my purse in my car and I don't take it in with me.
Thank you so much. Those are all of the questions that we have received from the team. Thank you so much for your time and supporting the team in Bangladesh with the latest updates as well as your valuable advice.
Thank you so much. Thank you for all of your hard work, everyone that's on the ground in Bangladesh. I really appreciate all of the work that you guys are doing to support the refugee population there. And if you guys ever need anything, please reach out. Bean has my contact information. Maryam, you will also have it through email or however you need to contact me.
Thank you. We do have one more point before we close, which is specifically relating to donning and doffing PPE. We have shared with our team a series of videos on how to properly don PPE and then how to properly doff PPE. Do you have any specific recommendations or points to keep in mind when we go through this process on a regular basis?
Yeah, so just be really careful with the doffing process, because I think with the Ebola crisis, I think that's how some of the healthcare workers got infected. It was with the doffing process. And so just being really careful to not touch any of the outside surfaces when you're taking off your gown, for example, or the gloves. And if you do touch the outside surfaces or even your mask, to make sure to practice hand hygiene, even in between the steps. That's really important because that's the best way to protect yourself.
Okay. One of the observations we've had is that sometimes healthcare workers will be in full PPE, but they will have their stethoscope or other, or like their ID badges on top. So like in terms of how much protection that is offering, or is it increasing the risk of infection? Can you speak a little bit on that?
Yeah, so definitely the badge I would try to keep inside the PPE. The stethoscope, obviously you need to use it, but also sanitizing that between every patient is really important.
Any pitfalls when it comes to donning PPE that we have to be aware of? As in, paying attention to the steps or any other pitfalls that we must be aware of?
Just again, like washing your hands before you don the PPE, so to protect your patients. But just making sure that the mask is covering your nose and your mouth, and that your eyes are protected, are all really important steps of protecting yourself from the virus entering your most vulnerable portals of entry in your face.
Thank you so much, Dr. Akhras. Again, we truly appreciate you taking the time to support our team remotely in Bangladesh. We have one more question. I apologize. My team just came through, which is, are surgical masks reusable? And if so, how many times can they be reused? And is there any recommendations on washing them?
So we have been reusing surgical masks in our hospitals. So our policy is that we use it all day unless it's soiled. So unless like a patient coughs on you and it gets soiled from the outside, or like you sweated so much in it that it's like soiled, so then you can change it out. I'm not really sure about the utility of washing. Like, will it stay intact? I think if there's limited resources, washing it, if it's still intact, is probably okay, or if that's the best you can do. But if you are able to change it out at the next day, then that's probably better.
Is it after using it for 20 to 30 patients during outpatient consultations, is it okay to reuse that same mask the following day?
So again, it just depends on how intact it is. If it's intact and it's not been soiled and it's still like okay, then, and you have limited resources, then it's probably fine to reuse it again. But if you have the resources to not use the same one the next day, then I would probably change it out.
I think that is all the questions we have for now.
Okay.
And thank you so much.
All right, thank you. And I'll talk to you guys later.